Welcome to everyone. There are 5 topics which we should be able to revise in 5 minutes, but frequently asked in the NEETPG. This is Dr. Murali Bharadwaj, your everyday mentor for preparation to the NEETPG. So, Chédiak-Higashi syndrome, Pelger-Hüet anomaly, Kostman syndrome, acute leukemia, hemophagocytic syndrome. So a very common clinical vignette asked in the exam. A 5-year-old boy with recurrent bacterial infection, nystagmus, partial albinism. His skin is pale, hair is silvery. There is a neutropenia, and neutrophils show large granules. Large granules, very important. And also, he has an older brother who had similar symptoms, and he had aggressive lymphoma with which he died at 8. So that is how Chédiak-Higashi presents. So what are the important features of the Chédiak-Higashi, doctor? Recurrent infections, nystagmus, partial albinism, large granules in the neutrophils, autosomal recessive inheritance, and fundamentally there is a defect in lysosomal transport protein LYST in the case of Chédiak-Higashi is what you need to remember. And they have a risk of developing lymphoma, aggressive lymphoma. So if you know these 4 or 5 points, tomorrow you are ready in the NEETPG, FMG, INI CET or any exam. Now, Pelger-Hüet anomaly. A 30-year-old woman is found to have abnormal blood smear. She has no symptoms and her physical examination is unremarkable, and the blood smear shows granulocytes with bilobed nuclei, which look like chashma, spectacles. Chashme ke jaise bilobed nuclei in the granulocytes. Now only go to the Google images and look how Pelger-Hüet anomaly typically looks like, which is the favorite question of the examiner. Her complete blood picture is within normal limits. There is no neutropenia or anything. What is your diagnosis? Bilobed nuclei in the granulocytes resembling spectacles. That's called pince-nez configuration on a blood smear. In a asymptomatic patient with a normal CBP is called Pelger-Hüet anomaly, which is a very benign hereditary disorder. So please don't forget Pelger-Hüet. Kostman syndrome. A 6-month-old infant presents with a history of severe recurrent infections after the birth. You're a pediatrician in charge. Pale, irritable infant, hepatosplenomegaly is there. There's a severe neutropenia. So in Kostman, CBP is abnormal, severe neutropenia. Neutrophil count is as low as less than 100. And there is a near absence of the neutrophils and neutrophil precursors in the bone marrow biopsy. Isko kehte hain Kostman syndrome, severe neutropenia with neutrophil count less than 100 and near absence of the neutrophils is basically called Kostman syndrome. It is because of a mutation of a anti-apoptosis gene. Please remember, anti-apoptosis gene, HAX1. HAX1 is what you need to remember. Now coming to leukemia. 7-year-old, fatigue, easy bruising, nasal bleeds, pallor, petechiae, anemia, thrombocytopenia, leukocytosis, significant leukocytosis. Lot of primitive myeloblasts, immature chromatin, nucleoli in some cells, primary cytoplasmic granules. You need to think about acute leukemia is what you need to remember. A 4-year-old boy with a history of Chédiak-Higashi has fever, hepatosplenomegaly, pancytopenia. There is an elevated ferritin, elevated triglyceride, histiocytes engulfing hematopoietic cells are there. So that is how fever, hepatosplenomegaly, Pancytopenia, histiocytes engulfing the hematopoietic cells constitute the hemophagocytic syndrome. Typically, it is the accelerated phase of the Chédiak-Higashi. So, doctor, this is how within 5 minutes you should pick up 5 most crucial topics and do the revision. So please like this video, share this video, comment on this video. I'm going to give a lot more NEETPG rapid revision shorts in 5 minutes.